medial part of the arm. Okay, so shape of the pyramid axilla. It is pyramidal shape. Okay, it is pyramidal shape having an apex and a base. Then four walls. Okay, medial wall, lateral wall.
Posterior wall.
Okay, medial wall, lateral wall, anterior wall and
Posterior wall.
ओके पेपर दे दो कल का नहीं है उधर कुछ पेपर ना है ना नीचे
उसमें डाल दिया सर वो
हाँ pyramid having four surfaces or four walls and an apex and a base. Okay, like this. So the medial wall and the lateral wall comes close when the arm is adducted, and the axilla is much appreciated when the arms are abducted. Then only we can appreciate all the four sides of the axilla. Here comes the apex and here comes the base, then four sides, anterior, posterior, medial and lateral. So first about the apex. So apex is not pointed, it is truncated. Truncated means it is not pointed, it is blunt, and it is also called as the thoracocervical opening or thoracocervical canal. So what is the boundary of the apex? See, here comes the apex. Here, therefore, a upper area. Here comes up. So this is the first rib. This is the first rib. This is the clavicle. And here comes the superior border of the scapula. So these three structures forms the upper boundary of the apex. और the और एक नाम क्या है? Thoracocervical canal. So canal between the thorax and the cervix. Okay, canal which communicates between the thorax and the cervix. So it is called thoracocervical canal. So आप बताइए anteriorly it is bounded by the or it is limited by the posterior border of the clavicle. Posterior border of the clavicle. Then medially it is outer border of the first and posteriorly superior border of the scapula and also the coracoid. So these forms the apex of the axilla. Okay, axilla apex or thoracocervical canal is bounded anteriorly by the posterior border of the clavicle, medially by the outer border of the first rib, and posteriorly by the superior border and the coracoid process of the scapula. So that is all about the apex. And what is the importance? Certain structures are passing through the apex or this canal. Okay, which are the main structures? One is brachial plexus. So brachial plexus is coming from here, from the cervical part, and it passes and enters the axilla through the apex. And another any other structure? Axillary artery. So axillary, here comes the subclavian artery, then forms the axillary artery and it enters the axilla through the apex. And one more structure, main structure, axillary vein. So my point is whether this axillary vein is entering or exiting. Whether it is मतलब एक axilla से axillary vein comes out. देखो आर्टरी एंटर होते हैं लेकिन वेन एग्जिट होते हैं. Okay, vein is going out from the axilla, but artery enters into the axilla. क्यों ऐसा? क्यों वेन ब्लड लेके हार्ट को जा रहे हैं, लेकिन आर्टरी ब्लड लेके हार्ट से पेरिफेरी आ जाएगी, इसलिए एक्सिलरी enters and vein exits. Okay, then base. Okay, then base. Base is and apex is direction of apex. It is directed upwards and medially towards the root of the neck. Okay, then base. Okay, base is concave in shape and it is directed downwards. Okay, and it's made up of skin, superficial fascia. Okay, axillary deep fascia of axilla, that is axillary fascia. Okay, with all this skin, superficial fascia, axillary fascia, this axillary fascia is called deep fascia. Okay, superficial fascia of the axilla and deep fascia of the axilla. Deep fascia of the axilla is called as axillary fascia. Deep fascia of the pectoral region is called as pectoral fascia. Okay, so that is all about the floor of the axilla. Then anterior wall. Okay, so anterior wall. Anterior wall इधर हम already देखा था. It is covered with the pectoralis major, उसके नीचे pectoralis minor, and one more. So what is clavipectoral fascia? So what is clavipectoral fascia? We will discuss it later. So anterior wall is formed by three structures: pectoralis major and minor, and clavipectoral fascia. Okay. Then posterior wall देखो. So इधर से एक इधर पेक्टोरालिस मेजर आ रहे, पीछे से टेरस मेजर आ रहे. ओके, सो इधर एक टेरस मेजर मसल है और लैटिसिमस डोर्सी एक मसल ऐसे नीचे से फ्रॉम द लंबार एरिया से ऐसे आके इट आल्सो इंसर्टेड इनटू द फ्लोर ऑफ द बाइसेप्टल ग्रूव. सो वो भी पीछे से अलोंग विद टेरस मेजर में आ रहे. और वन मोर मसल इज द सबस्कैपुलर. कैसे सबस्कैपुलर फोर्से में आके इट इज इंसर्टेड इनटू द बाइसेप्टल ग्रूव में है क्या सबस्कैपुलरिस. सर किधर है? क्या हुआ? हाँ वो बताया था अंकिता से बताया, लेकिन दो कब बताया था अंकिता? आप दोनों किधर गए? साथ में थे. So subscapularis is inserted to subscapularis is inserted to the lower part of the greater tubercle of the humerus. So subscapularis is one among the four group of muscles. What is its name?
Musculotendinous cuff.
Musculotendinous
cuff. Tendinous cuff.
और उसका नाम
Rotator cuff.
rotator cuff muscle. Okay. So subscapularis is also coming. So posterior wall of the axilla is formed by teres major, latissimus dorsi, and subscapularis muscles. Anterior is formed by two muscles, pectoralis major and minor, and clavipectoral fascia. Posterior by three muscles: teres major, subscapularis, and latissimus dorsi. Okay. Then they go medial wall. So axilla is extended from first rib to the fourth rib. Axilla is extending from the first rib to the fourth rib. Okay. So इधर कौन सा मसल आते हैं? Serratus anterior is originating from the upper 8 ribs. Okay, and is inserted to the inserted near the lateral rib on the costal surface of the scapula. Okay, so this area is covered with the medial wall of the axilla is formed by the serratus anterior muscle. Only serratus anterior? Serratus anterior only? Intercostal muscles also. Intercostal muscles also, and the rib, upper forerib. Okay. Then medial wall. Sorry, lateral wall. So देखो ये medial wall थोड़ा expanded है, लेकिन lateral wall ऐसे expanded नहीं है क्योंकि this anterior wall and posterior wall comes closer each other when it comes to the lateral wall. समझ में नहीं आया? इधर से आ रहे मीडियल वॉल से एंटीरियर एंड पोस्टीरियर वॉल आ रहे, ऐसे आने के टाइम ये दोनों लैटरल वॉल में एंटर करने के टाइम इट कन्वर्जेस, इट क्लोजेस टुगेदर और इट कम्स नियर बाय. So medial wall, sorry, lateral wall is short or narrow. Okay, lateral wall is narrow and it is formed by the upper part of the medial surface of the shaft of the humerus near the bicipital groove. Okay, or the region of the bicipital groove. Okay, and one more. Here, this is the tip of the coracoid process. A tip of the coracoid process से दो muscles आ रहे, कौन सा है?
Short head of bicep.
One is coracobrachialis and another one is the
Short head of the bicep.
short head of the
Bicep.
So ये दोनों muscle भी ये side में है. So not only the upper surface of the shaft of the humerus and also the short head of the biceps and coracobrachialis forms the lateral wall of the axilla. Okay. And then contents of the axilla. Contents of the axilla. वो axilla वो region में क्या structures है? So totally 7 structures are there. So आप बताइए, first one is the axillary artery and its branches. Not only axillary artery, वो axillary artery से branches भी आ रहे हैं. So its branches also is the content of fundamental content of the axilla. Then axillary veins and its tributaries. Then next is infraclavicular part of the brachial plexus. What is infraclavicular? हम already discuss किया था. Brachial plexus originates from the cervical spinal nerve C5 to T1. So it originates from the root level of the cervical spinal nerve and it forms the brachial plexus, and this brachial plexus extends from here, from the cervical vertebrae up to the axilla. So brachial plexus can be divided according to its region as the part of the brachial plexus above the clavicle and below the clavicle. So we are dissecting the area below the clavicle. So you can see only the infraclavicular part of the brachial plexus. Infraclavicular part of the brachial plexus. Okay, so third content is infraclavicular part of the brachial plexus. Then fourth one is lymph nodes. Okay, axillary lymph nodes. 5 group of lymph nodes can be seen in the axilla. So that can also be seen, lymph nodes and lymphatics. Okay, lymph nodes and lymphatics. So fourth is lymph nodes and lymphatics. Then fifth one is areola, axillary fat and areolar tissue. So that is loose. Some अभी हम वो axilla का fat निकाल रहे. So fat and areolar tissue, loose areolar tissue, because axillary area, when we palpate the axillary area, it is loose, okay, or soft because of this loose areolar tissue. Okay, then next is axillary tail of the mammary tail. So that is commonly seen in females only. In males it cannot be seen. So axillary tail of the mammary gland. And then one more is long thoracic nerve and the intercostal brachial nerve. Okay, long thoracic nerve and intercostal brachial. So what is long thoracic nerve? Long thoracic nerve किधर से origin होते हैं?
C5 to C7.
Root. So root of C5, C6 and C7. Okay, long thoracic and its other name और एक नाम क्या है? Nerve to serratus anterior. Long thoracic nerve or now to
Serratus
serratus.
angle.
So it originates from C5, C6 and C7.
C7.
The root of the brachial plexus. Okay, and comes and supplies the serratus anterior muscle. So that can also be seen in the axilla. And one more is the intercostobrachial nerve. What is intercostobrachial nerve? हाँ क्या है वो बात? So that is a cutaneous nerve.
Cutaneous
है ना? Cutaneous, which supplies the skin. Okay, which supplies the skin of the upper part of the pectoralis major, pectoral region, upper lateral part of the pectoral region, and also the floor of the axilla, and also the upper medial part of the
Brachium.
arm. Brachium. इंटरकोस्टोब्रेकियल मीन्स नाम से भी समझ में आया.
Yes,
इंटरकोस्टो मीन्स इंटरकोस्टल एरिया में सप्लाई करते हैं. एंड ऑल्सो
Brachium.
ब्रेकियम मीन्स आर्म का अपर मीडियल एरिया में भी सप्लाई करते हैं. एंड ऑल्सो द फ्लोर ऑफ द एक्सिला. ओके, सो दिस नर्व ऑल्सो. So in this axilla we can clearly see the infraclavicular part of the brachial plexus. Then axillary artery देख सकते, axillary vein देख सकते, fat lymph nodes देख सकते. But a intercosto brachial nerve, then lower thoracic nerve, ये सभी थोड़ा मुश्किल है. ओके, देखने में. एंड axillary tail of mammary gland also, क्योंकि ना ऑलरेडी हम वो निकाल दिया, ब्रेस्ट निकाल दिया, इसलिए वो लिखने के लिए थोड़ा मुश्किल है. इतना अभी पढ़ना में पूछेंगे, ठीक है.